feel fine, you think you don't have hypertension. That is a huge lie. So hypertension is known as a silent killer. That means that you don't even know, you can't tell that you have it until you check. Hypertension starts very slowly, you won't feel anything. When you actually start feeling something is when hypertension is already doing the bad thing to you. It's already hitting your brain and killing your kidneys and doing all sorts of nasty things inside of you. So no, when you feel fine doesn't mean you don't have hypertension. This is a tricky one to answer. You know, initially we said that wine is healthy for the heart, and then later on another study came and said it's not so good. But I think the most important thing is that everything in moderation. Yes, wine has some health benefits, but you need to make sure that you are not overindulging or drinking too much. Don't go drinking a gallon of wine telling me that that's your glass of wine. No, we want you to stick to very minimal amounts. Remember that alcohol can worsen your hypertension. Alcohol can make it difficult to control your hypertension. So please stay away from alcohol as much as possible, or everything in moderation. So if you inherit hypertension, there's nothing you can do about it. Nah, man. I think there's always something you can do. One of the most important things is to keep exercising and eating healthy, keep the stress low. Those are the things that would help you to keep hypertension away, or even delay it for as long as possible. The fact that you have somebody in your family who has or had hypertension doesn't mean you need to get it, but it means that you can get it. What you should do is to eat healthy, exercise, keep the stress low, and with all of these you can beat hypertension. If you don't salt your food, salt is not a big issue. So apart from added salt to your food, there are other sources of salt. So salt can still be a big issue. Remember that if you are eating processed foods, there's so much salt already in that. When you buy food from outside, you don't know how much salt is being added. So you always need to be very mindful. When you are preparing your food, check how much salt is in there. You need to have a minimum of 2.4 grams of sodium a day, and just make sure that you are keeping to a minimum. So not just added salt, but salt from all sources is important to look out for. So now you know some of those assumptions about hypertension are just myths. We've come to the end of today's show, and I want you to take away some important things. Remember to eat well, sleep well, exercise regularly, and keep the stress low. Malaria is fatal when you don't treat it and when you don't get to the hospital or get treatment early enough. Don't get it twisted. To a certain degree, immunity is possible. Yes, to a certain degree. But that doesn't mean that you cannot get malaria again. You can get protection from it if you've gotten malaria before, but it's definitely possible to get it again. Not only Africans, Asians, anybody can get malaria. But the only thing is, like I said earlier, malaria is usually found in sub-Saharan Africa, Southeast Asia, and some other regions. So when people from other places, from Europe, from America, from Australia, come to those regions, they can get malaria, not just those people living in those areas. No, that's such a wrong move. You can't prevent malaria by taking anti-malarials. There are specific medications out there for preventing malaria if you are traveling to a place that has malaria commonly found there. So there's an important way to use the insecticide or the treated mosquito nets. There are instructions. When you get the mosquito net, you are supposed to air it out for about 24 hours. This helps to lessen those reactions and irritations that you will get when you just use a net like that. So that can help you reduce those itchy eyes or burning sensations you might feel from a fresh or brand new mosquito net. So just use it properly and you can prevent malaria. So yes, we've dealt with some questions, we've busted some myths, and before we end this show, I'd like to tell you how you can prevent malaria. First of all, learn to use insecticide. You can make sure that you clear bushy areas around your house, your surroundings, and make sure that there are no collections of water. When it rains, make sure that water is pushed away. Don't leave gutters choked, because these are breeding grounds for mosquitoes and makes it easy for you to get malaria. You can sleep under a mosquito net. That would help you. Use some of those repellents on your skin. And remember, always eating well, staying active, and staying healthy helps you to prevent disease. Diabetes does not affect only people who are obese or who are overweight or increased weight. It can affect anybody of any size depending on a number of factors. Those factors can include, weight gain is one of them, alcohol drinking, if you have hypertension or high cholesterol, if you are sedentary and not active, your diet is also not adequate or includes high calories. All those things can push you towards being diabetic. Diabetics can't eat sugar. Oh, that would be so sad, wouldn't it? But fortunately enough, this is not true. Diabetics can eat sugar, they can eat a number of things, but then your dietitian will have to advise you on how much to take. So don't go out there pouring so much sugar in your food just yet. Talk to your dietitian first. Diabetics don't have to lose their legs or go blind just because they are diabetics. That will only happen if you don't take your medication and you are not eating healthy. We would advise you to please stick to your doctor's advice, stick to your medication, and always reach out to us if you have a problem. If you don't, that is when you may lose your leg, you may go blind, you can get a heart attack, you can get a stroke, you can lose your kidneys as well. Diabetics shouldn't do hard work. Not at all. Once your diabetes is well controlled or your blood sugar is well controlled, you can pretty much do anything anyone can do based on your doctor's advice. Depending on how much activity you need to do, we can tweak or switch up your medication to make sure your sugar doesn't go too low or too high. So remember, it's always good to talk to your doctor first about what you do and about your activities. Diabetes is not like cholera. Diabetes is not an infectious disease. It is not contagious. You won't get it from sitting next to somebody or somebody coughing on you can pass on diabetes. That can happen. So diabetes is not contagious. Those were some sweet myths, right? But so not true. Today we have learned a lot. And once again, just like when we learned about hypertension, the important things are to eat well and exercise properly, and we want you to just keep a healthy life, stay active, and keep your family healthy. For most of the time, sickle cell disease can be painful, not all the time. However, it is not a contagious disease. It can't be transmitted like HIV can't be transmitted. Remember, it is hereditary, it's through genetics. So you are born with it. It's not an infectious disease. Nothing at all prevents you from marrying anyone with a sickle cell trait. You just need to be aware of your risks. You also need to know whether you have the trait or not, and then know what you're getting into and the potential of having children with sickle cell disease. But nothing prevents you from marrying someone with sickle cell traits. Sickle cell disease patients can live very long lives. I've met some in their 50s, 60s, and even 70s, and they do not necessarily live up to 21 and die. This is so false. Does breast cancer only happen to middle-aged and older women? This is not true. Breast cancer can affect a wide range: younger women, middle-aged, and older women. It just happens to be very common in the older people, but it can affect all of them. So carrying your phone in your bra or your breast pocket will not cause breast cancer. This is false. The reason is the radiation from the cell phone has been found to be at safe levels, and so this is not a reason of concern for us at this moment. So it's so not true that if someone in your family hasn't had breast cancer, you cannot get breast cancer. Anyone at all can get breast cancer, and don't depend on your family history on determining your risk. I would like you to like this video, subscribe to this channel so you don't miss out, and then comment in the section below and join the conversation on social media. Remember to stay healthy, guys.